Okay, guys, so we'll probably just get started now and wait for others to join, and they can just join as we go along. So if you're ready, feel free to introduce yourselves and start the session.
Okay, great. Let's get started then. Hi everyone, it's nice to be able to talk to you today. I'm Anishka and I'm a first year medical student at the University of Liverpool. I'm also joined by Rima, who's a second year medical student at Birmingham. So if you just want to say hi as well,
Hello,
Rima.
everyone. I'm a second year at Birmingham and I received an offer for Liverpool as well.
Great. So yeah, let's get started then.
Mhm. Okay, so in terms of what we're aiming to get through this session is just give you guys a taster of what life at Liverpool is like and how medicine is taught as a course as well. And this will help you with answering, for example, why Liverpool, if you were to be asked that in your interview. And then we'll be focusing on medicine interviews and the kind of questions and stations that you would be expected to encounter on your interview for Liverpool, as well as giving you guys a chance to practice answering some with some feedback from both of us as well. And at the end, I will be answering as many questions as I can through the chat. But there will also be a section at the end where you guys can ask us questions directly and we can hopefully clarify any concerns or doubts that you might have about the interview or about life at Liverpool as well. Um, yeah.
Okay. So let's start by talking about the course structure at Liverpool. So essentially, we're taught via integrated system blocks. So we're taught the physiology, biochemistry, anatomy, pathology, microbiology, pharmacology, genetics, and cell and microbiology for each different system at a time. And the systems we cover in year one are the foundation blocks, which are your core science blocks, then endocrine, musculoskeletal, urogenital, respiratory, gastrointestinal, cardiovascular, and neurosensory. We're also taught via a spiral curriculum. So that basically means that in year one, you're taught about all the normal aspects of the body. And in year two, you then go on to talking about the abnormal side of things. Now, this is really good because you end up kind of covering things that you've already done in year one again in year two. So you're often reinforcing those concepts again. So it's actually quite useful for your learning. You're also taught, alongside the system blocks, you're taught these interwoven themes. So there's professionalism, ethics, and legal context, which is PEL. There's psychology and sociology as applied to medicine, which is PSM. And there's public, preventative, and global health, which is PPGH. And additionally, you have practical classes. So we were taught anatomy via pro sections, which again, I'll talk about in more detail in a future slide. And then we have clinical skills where we're taught the basics of examinations and communication for clinical practice, where we're taught about how to have real consultations with actual patients. We're also able to attend a half-day health in the community placement in first year. So that's basically a placement at a third sector community or a charity organization. I think the university kind of wants you to have experience with third sector organizations just because you haven't really delved into medicine fully yet by the end of year one. So they don't really want to put you in a hospital and GP straight away. So it's just kind of easing you into that placement experience in year one. But in year two, you do have hospital and GP placements more regularly. So that is good as well. Um, so, in terms of the teaching methods that are specifically used at Liverpool, we start off by having preparatory lectures. So they're lectures that are released online in advance, and you're able to access them via the university's portal, essentially. And once you've watched all of these lectures, you then have interactive seminars with lecturers. And this is basically just an opportunity to interact with the lecturer themselves, ask any questions. They also ask you questions. So they ask you multiple choice questions via like an anonymous system. So you can give your answers. And they often just try to reinforce any sort of difficult concepts or anything that's quite high yield as well. So these are quite useful after you've watched the preparatory lectures for them. We're also taught via small CBL and facilitated CBL. So the difference essentially is small CBL, you're not supervised. So you have a group of like 10 people, and you basically just go over the cases and you go over the questions for that. And then you have facilitated CBL, which is where you have a tutor who's going through those questions with you, and they basically just help tell you the answers to the question and things like that, and make sure you've understood concepts. So it is very like small group focus, which is quite nice, and it helps you really learn and clarify any doubts that you have. Then we move on to anatomy. So we call that HARC over here. That's Human Anatomy and Resources Center. And that's a pro-section based anatomy session. So often you would have done your preparatory lectures in advance. So you'll know all about the anatomy before you go into anatomy. And then all you have to do is have a look at the pro-sections. They might be like quite big pro-sections. They might be small ones of organs, or they might even be cross sections of organs. So you get to see quite a variety of pro-sections, which I think is really good. You then have interactive workshops for the interwoven themes that I was talking about. So that's PEL, PSM, and PPGH. And this is a really nice way of kind of interacting with other peers in your year group and talking about things such as mental health or like alcohol intake and things like that, where everyone has their own experience and they share it together. And that just encourages more of a discussion-based approach. So you do often have to watch preparatory lectures in advance for that as well. Then we move on to communication for clinical practice. So this is very, very small group teaching sessions where essentially you learn how to interact with the patient. So often you have to do a consultation, a one-on-one with an actor, and you have a tutor who gives you feedback essentially on that. And then you have clinical skills sessions as well, where you're learning the basics of examinations, and they're related to whatever system block you're doing. So right now I'm doing urogenital, so we have to do like rectal examinations or male genitalia examinations and things like that in clinical skills. And this is also really useful because you end up reinforcing all the knowledge that you have of anatomy and like clinical presentations of things as well. So it's all really good consolidatory knowledge. Then we move on to research and scholarship lab work. So this is a thing that the university have integrated just to make sure that you keep in touch with your lab work skills that you learn in A-level biology and chemistry. And this is really good because you get to see about how things are done in terms of like microbiology and histology. And you also have the opportunity to write up a lab report on that, which tends to be an abstract. And that's basically marked formally, and that how you do in that abstract basically affects your performance in the year. So that's really good. It kind of introduces you to the research world as well, which is really nice. And especially since Liverpool is a Russell Group uni, they do have quite a big focus on research here. And the last two things on my list are to do with the end of block test. So you have a test after every block has finished, and you tend to have a large 3-hour review session on all the questions on the test with all the lecturers as well. So it's really helping you make sure you completely understand everything before you move on to the next system. So here's a sample week of my timetable and what it looks like. So this week I had my RS labs. So I was basically just doing lab work all day. Then on Tuesday I had clinical skills, where we learned how to do like rectal examinations, and I had a lecture after that. On Wednesday, I had my end of block test for urogenital. So that's kind of like an online test using the university's like testing system. And you can basically do that test whenever you want in the day, and you can take however long you want with that as well. It's just an opportunity for you to test your own knowledge and understanding. Then I had large CBL, so that's with my tutor, where we went through all the answers of the cases. And then I had two lectures after that. And on Thursday, which is today, I had a stigma and intersectionality workshop. So that's part of the psychology and sociology as applied to medicine interwoven theme. So that was quite nice. And then two lectures. And on Friday, which is tomorrow, I have anatomy, where we're starting off our new system block as well. So it does seem like maybe there's not a lot in my timetable, but that's because there's a lot of preparatory work to do. So I have additionally between kind of 8 to 10 hours of like online recordings for different things, plus extra prep for things like anatomy and the workshops as well on top of that. Okay, so the big question is why Liverpool? Why did any of you guys apply to Liverpool? And that's because there is a lot of good things about the uni. And I think for this sort of a question, you may or may not be asked, but it's really good to always prepare just in case you are. It's really good to structure your answer thoroughly for this one. So talk about the course, then talk about the academic side of things, and then talk about other personal factors that affected why you applied to Liverpool. So in terms of the course, we mentioned that there's an integrated system block-based teaching with spiral curriculum that helps to reinforce concepts and allow you to see the bigger picture. Then there's also quite early clinical exposure. So in second year, you do have hospital and GP placements. Then pro-section based learning as well. And if you move on to academics, there's the opportunity to intercalate in your fourth year as well, which is really good for your like sort of research and portfolio side of things. Then you also have these research and scholarship projects that you do every year in year one, two, and three, where you write up your findings, write up abstracts, get that practice of doing like research. The city is also incredibly diverse and there's lots of things to do, which I will talk about a little bit later. And in terms of the hospitals, there's lots of secondary and tertiary centres, teaching and trauma centres, and Rima is going to talk to you a little bit more about that in a future slide as well. And there's lots of societies to get involved with too. So if you have been to the open day and you've seen or spoken to some of the students at the uni, then definitely mention it. It's really nice to show that you've gone there and you've actually had a look at the uni. It shows that you're very insightful as well if you're speaking to people about what they like and what they dislike about the uni as well. Okay.
Okay, so in terms of the hospitals or placement experience itself, I think this was one of the biggest selling factors for me in order to apply for Liverpool. There are many secondary and tertiary centres that you can be able to do placement in, as well as 130, perhaps over 130 GP practices as well. There are major teaching hospitals such as the Royal Liverpool Hospital, as well as really specialist centres such as the Liverpool Head and Neck Centre. There's also Liverpool Women's Hospital. So if these are specialities that you're quite interested in, it gives you access to different cases, different patient stories that you wouldn't be able to access elsewhere. Um, and again, it all contributes towards your learning on placement and helps you become more of a well-rounded doctor by the end of the program. And perhaps it could be of interest for you to look up maybe some specific research or trials that may be happening within specific hospitals that you could potentially get involved with. Mhm. We can move on to the next slide.
Yeah.
And in terms of Liverpool as a university itself, offers a lot more than just the course itself. There are many societies, over 200 societies that you can join, and there is definitely something for everybody. And this is just a snapshot of some of the many societies that are on offer, such as Liverpool ENT Society, so there's speciality societies as well, that you can join if there's a particular interest of yours, and you can meet with like-minded individuals, and it also helps you have a more well-rounded university experience. And often a lot of these go well with your medical school timetable as well. And it gives you more opportunities to make better connections with people over things that you're all interested in as well. And if there is something that you are interested in, but you can't find a society, you can also start your own society with a group of friends. So there is 100% something to do for everyone. So it's not a case of you're only doing medicine, but you are also engaged in extracurricular activities outside of medicine as well.
Okay. So let's talk about Liverpool as a city itself. It's definitely a very interesting city. It's very fun, diverse. There's lots of things to get involved with, regardless of your interests and hobbies and things like that. So this is just a picture of a massive shopping complex in the middle of the city called Liverpool One. It's really, really big. So if you are a shopping fan, then this is absolutely for you. Then if you're into kind of nightlife and things like that, it's got very good nightlife, so I'm sure you'll enjoy that. And there's a ton of things to do. Then this is an image of the Royal Albert Docks. It's really pretty, especially by sunset, and there's lots of nice food places around as well. And if you're an avid football fan, then there's Anfield just around the corner. And there's definitely a lot of matches that keep happening every weekend. So you're bound to go at some point. This is a really beautiful library that I just discovered in the city centre called the Liverpool Central Library. It's really, really big and nice place to work in. And this is Sefton Park. So it's really close to one of the university's accommodations, Greenbank. And I'll talk a bit more about accommodation later as well. But this is just one of the most gorgeous parks in all of Liverpool. So it's nice to have that right by your doorstep. This is just a snapshot of what Liverpool looks like in Christmas. The Christmas markets were quite successful last year as well. So it was really enjoyable. And obviously, Liverpool is located on the west coast, so there's lots of nice beaches, and this is Formby Beach, definitely worth exploring. And just to say that there's lots of different food places, so if you are a food lover, you'll have a very fun time. So, moving on to accommodation. So, these are the kind of main uni accommodations that the uni provides. So, we have Crown Place, which is on the center of campus. It's self-catered and en suite. So, this is an image of Crown Place. It's literally so central that you can pretty much see the lecture theatre from your room, which is very convenient in terms of location. Then you have Greenbank Student Village. So that's a 15-minute bus journey from campus, but you can get a subsidized bus pass available as well. It's self-catered, en-suite, and it's just a stunning setting. It's got a lake on campus as well. And it's minutes from Greenbank Park, Sefton Park, and Lark Lane, which has some really nice food places. So this is where I live at the moment as well. It's also really nice because I think I've made a lot of friends. There's over 1,000 people who stay at Greenbank, so you're obviously going to make quite a lot of different connections, especially when you take the bus every morning. So moving on, then we have Philharmonic Court. So that's on campus, self-catered and en suite. So that is that one. And you have Melville Grove as well. So that's on campus, self-catered, and it has shared bathrooms instead of being en suite. But it's also really nice. And these are just a couple of minutes from like all the med buildings as well. And then lastly, we have Vine Court. Now that's on campus, but the thing about that is it offers either self-catered or catered meals as well. And it's en suite. So there's a large variety of accommodation. And if not, there are lots of private accommodations that a lot of people stay in as well. Okay, so moving on to medicine interviews. So interviews are obviously like next week, the week after. So I understand that this might be quite a high stress kind of period for everyone right now. But just to say that honestly, my interview was a really enjoyable experience. I feel like I learned a lot from it. I learned things that I didn't know before. And just it was a really nice chance to interact with people who actually work at the uni as well. So it was definitely very enjoyable, albeit stressful, because you feel like it does matter a lot to you at the moment with the application process. So I get that it's stressful, but just try and enjoy it as much as you can. You'll have 6 to 7 stations, and the expected stations for 2026 are likely to be these ones. So you've had an email about this already. So there's teamwork and communication, where you'll get 3 questions. There's healthcare awareness, where you get 3 questions. There's an ethics preparation station. So that's an unmanned station where you just go in and read something, and they'll ask you questions about it in the ethics discussion station, where there's 2 questions that they're going to ask. Then you have roles of a doctor, where there's 3 questions. And another healthcare awareness with 3 questions, and social media and professionalism with 2. So, just some tips that I've got for the interview. My first tip is practice makes perfect. So, try to do lots of practice mocks, especially with people you don't know, or if you happen to know anyone who's probably a medic or anything like that, family, friends, do interviews with them and ask for feedback so you know where to improve. Also, practice answering questions in front of a mirror. So this really helped me because I was a little bit like shy when I was doing my interview prep, and I did so much talking to myself in a mirror that I ended up becoming more confident with answering questions. So I definitely think that helps. My second point is keep up to date. So try to read BBC News Health section every day and try to read the BMJ too, especially since there are two healthcare awareness stations in the interview, so they're bound to ask you something, and they're bound to ask you something that maybe you haven't already prepared for as well. So it's definitely useful if you come across an article related to it, just bring it up in the interview. It's really good. Um, my next point is come across as friendly, chatty, and passionate about studying medicine from the very start of the interview. Go in and tell the interviewer it's lovely to meet them and thank them at the end. And try to appear confident, but not overconfident. There's quite a fine balance between being confident and overconfident. So just try and kind of moderate some of the things that you say just to sound kind of quietly confident and not too much, if that makes sense. Now, Liverpool is known to ask questions that you might not have prepared for. So if you aren't sure what to say, tell them it's an interesting question, ask if you can take a moment to think about it, and subsequently take a logical, systematic approach and answer the question. Um, and my next point is structure your answers. So it doesn't only help you, but it also helps the interviewer with their marking. If things are nicely organized and structured, then they're more likely to give you all the marks that you can get for something. And then for the ethics preparation station, try to relate the medical ethical pillars to the text as much as you can, or wherever it's relevant, try to think about pros and cons to something as well. Try to also think about things that weren't mentioned in the passage that you'd either like to know more about or things that you would have liked done differently. They like you criticizing things and having an opinion about things, but you do have to make sure you're providing a sort of balanced outlook about whatever they propose in the station. And make sure you look at things from a holistic perspective. So Liverpool are very big on the biopsychosocial model. So definitely think about how the sort of biomedical side of things interacts with psychological side of things, which interacts with the social side of things, and try and think about all of that when you're reading whatever text they give you in the ethics station. And my last point is if you finish early at a station, don't sit in an awkward silence. Be inquisitive, ask the interviewers polite questions, or even just ask how they're doing. Liverpool love giving offers to genuinely friendly people. Rima, do you have any other tips to add as well?
I would echo everything you said. If anything, I would say also, um, even if you did get any follow-up questions, do take it in like a very good spirit. So be adaptable on the spot. Take opinions like just like it was already mentioned. It's important that you don't seem like you should be able to take on board feedback and adapt your discussion as well. Very much, especially for the ethics station, it is very much I felt almost like a conversation. So in my station in particular, they would give me ideas and I would share ideas, and it felt very much back and forth. So the more open you are, it makes it a lot easier and less stressful, I would say as well.
Mm, that's absolutely true as well. Yeah, for the ethics preparations, you aren't really going to know the direction you're going to take. They're going to give you hints, and you have to be receptive to those hints. So, absolutely good point that you mentioned. So, let's move on to the practice MMI questions and personalized feedback. So, we need three volunteers. Does anyone want to have a go at
Hi
questions?
Anushka, sorry to disrupt your MMI stuff before they volunteer. We've got a few people discussing in the chat whether there's a station at Liverpool medicine interview for personal statement. So, without giving away the questions, how useful would you say personal statement preparation is for these guys?
I personally didn't get asked about my personal statement. They probably would have read it, but they're more interested in your own experiences. So if you can highlight some of the experiences that you've written about in your personal statement, for example, if they ask you about like what you learned from your work experience and things like that, you might end up sort of repeating the content on your statement, but they won't necessarily ask about your statement, and they definitely won't have it like in front of them or anything either. So I just think they're very interested in getting to know you on the spot right there and then. So that's what I would say. Is
Okay, I
that
think Emma said that she would like to volunteer.
okay? Yeah, sure, we could do that. So the first question I have then, let's do that, is This one. So you've been on call for 12 hours and your shift has ended, but the colleague taking over from you hasn't turned up. It's been half an hour. So discuss how you would handle a situation. You can take a second before you think about it as well, um, and then give it your best shot.
I'd like to start by saying this is quite a difficult situation for a few reasons. I think it's a difficult situation because after 12 hours of a shift, I'm obviously quite tired, worn out, and that might actually affect patient safety if I'm left to treat other patients and I'm not in an optimal state in terms of my own health. I feel like another consideration is that in this sense, the colleague has perhaps been um, irresponsible in not making it to their shift on time and not communicating this. However, upon having this difficult situation happen, I feel like I would need to be empathetic in a way to my colleague, as I wouldn't want to assume the worst of them, as potentially there is a very serious reason that they may be late. So I think when treating this situation, I don't want to make any false assumptions or jump to conclusions. However, I do want to ensure that I prioritize patient safety and acknowledge that I'm tired. So, as it has been half an hour, if the hospital isn't currently very busy or packed, or perhaps I can discuss to someone else if I can have a moment to see if I could perhaps contact the colleague. Because in a situation like this where you don't want to assume, you don't want to blame, I feel like it's really important to try facilitate this communication with the colleague to find out what's happened, are they on their way, and if they're okay as well. Because within medicine, the type of people to go into this career are usually people who do care about others and are passionate to help people. And if this is not a repeated behaviour, I wouldn't like to jump to conclusions. So if I had a moment, I'd try communicate with this colleague and see if I can find out what's happening and if they're on their way. Now, if I can't get any further information and the colleague is not remaining there, I would probably see if there's any other doctors perhaps that can come in on my shift, and I'd speak to my seniors on ward at the time if there's anyone available in senior staff, because I do believe it is really important that after working a long shift like 12 hours that I'm not putting patient safety at risk if I'm, as I've often mentioned, tired and not being able to give to best service. So I would contact any senior um, staff members within my hospital at the time and see if there's any way I could perhaps request for help or something can be done. Next, if there was unable to be an immediate resolution, if I did, or if the hospital was busy or they were preoccupied, I do believe I would try continue the shift if I am, of course, able to, and I do believe that I am still able to provide a quality of care which is respectable to the patient. I would continue until there is a little break where I can figure out and plan the next steps. But overall, I do believe that this is a very difficult situation, and if it was to reoccur, I would definitely report it if it was the same colleague, but I would first try facilitate communication with them in a respectful manner, seek senior help if I couldn't, and worst case scenario, continue doing the shift, but only if patient safety is not at risk.
Great. Thanks so much for that, Emma. I really liked your answer. It was very clearly structured and you brought up a lot of good points. So I'll give you some feedback on like some of the things that you talked about. And I'll also put in a general kind of mark scheme I have for this question. So you did mention that it is difficult as a situation because you've already worked 12 hours, you're tired, you're worn out. So you're worried about like if your care is going to sort of affect patient safety because you might not be at an optimal state at the moment. So in that sense, you've got to kind of you said you have to be empathetic and sort of see why your colleague isn't here, first of all, and not jump to any sort of conclusion. So I really like that. And definitely mention the empathy side of things because Liverpool are very big on sort of empathy and that kind of thing. Because obviously there could be a serious reason as to why they haven't come in, or there could have been a misunderstanding, like someone's allocated a shift when they perhaps didn't agree to it or didn't know about it. So it could be a genuine error. And in that case, contact the colleague if you can reach them, and just ask if they're okay, because ultimately you are colleagues, right? You have to make sure that you're sort of respecting your colleagues' well-being and like making sure they're okay is a very good thing to say. Um, and then if you can't reach them for whatever reason, then escalate it to the senior doctor. So whether that's a consultant. And if you can't sort of immediately resolve for cover, so for example, like locum cover or someone else covering the shift, then continue to do work. But I would say try to avoid any non-urgent tasks on while you're working. So try and just make sure your patients are stable. So because you've got that duty to kind of make sure you can provide safe care to your patient as well. So you don't want to put patient safety at risk at all. And then you mentioned like if it's happening again, or even if it doesn't happen again, really, you can document the event and reflect on it. So that's kind of what I would have said maybe you could have talked a little bit more about. So reflection and why it's important to reflect events like this, because obviously you don't want things like this to happen again, because it affects sort of the patient handover. It's going to mean that maybe communication between the doctor that's currently working and the next doctor isn't the best, and you might miss certain things. And you also don't want to be short-staffed, understaffed, or tired because all of those things are going to contribute to patient safety, isn't it? So it's really important to reflect. So definitely try and just mention reflection in any answer because you can always kind of link it in some way or the other. So that's kind of the only bit of feedback I would give you. But other than that, I really liked your answer and well done with that. Rima, do you have anything else to add?
Thank you.
No, I think the feedback pretty much covered everything. Yeah.
Okay, great. Should we move on to the next question?
hmm I
Okay,
think
who should we pick for this one?
I think Eleanor. I'm sorry, not Eleanor. Leonor was the next person who said they'd like to volunteer.
Okay, so Leonor, you can have a minute to think about this if you want, but the question is, should medical research be conducted on animals?
Hi, okay. I'm going to give this a shot. So, I would like to outline the reasons that animals are used in medical research, as well as pull in the pillars of medical ethics to evaluate its use and then come to a conclusion. So, the primary animals used in medical research range from rats to sheep to pigs, and this is because they have a very similar physiology to humans, and oftentimes react to drugs quite similarly. And this, in turn, can be used in earlier stages of drug trials to kind of see what sort of effects, benefits, or risks a drug could pose if administered to a human. Now, you could argue that because you're able to test these drugs without and spot any harmful effects prior to testing on humans, this could prevent any arguably avoidable harm to people prior. Sorry, you could point out any potential risk or harm prior to administering it to humans. However, you could argue that harming animals is also fairly unethical because oftentimes they're sentient beings, they have nervous systems, and so would be able to feel these potential painful side effects or it could have drastic effects on their bodies as well and lead to their deaths. However, oftentimes these drugs can be greatly beneficial for public health. For example, painkillers, or which are helpful to the masses, from paracetamol for headaches, or morphine for pain management for terminally ill patients, or patients who need this pain management post-surgery, which ultimately you could argue is in their best interests too, to minimize discomfort and minimize symptoms whilst being treated. Now, I guess the primary argument truly is whether or not it's ethical to compromise the comfort of animals in order to benefit the masses of people, which makes this quite complex. But if you were to look at it from a, I guess if you were to consider the harm done to animals, you could also consider alternative methods rather than just testing on animals, possibly even tissue cultures, or which would not actually cause any harm to any sentient being, rather than causing harm to a sentient being just because they're not human prior to testing on human, to prevent causing any harmful side effects to a human prior to being approved for the masses. But overall, I think animal testing should continue, barring the drug has somewhat promising effects and benefits to public health, as well as I guess you could say, as long as it has a promising benefit to people and to public health, which outweighs the drawbacks which the animal or could face at that point, or if tissue cultures or any alternative were not available.
Great, thank you so much for that answer as well. It was definitely a really good answer. You raised a lot of good points. So let's talk a bit more about what you said, and I'll just give you the mark scheme that I made as well. So I liked your introduction because you said what you were going to sort of talk about, and that you were going to link the pillars of medical ethics into it as well. In terms of like animal research, it's obviously contributed a lot to medical advances, right? And you mentioned that the animals that we do use are like rats, sheep, pigs, that kind of thing. They all have very similar physiology, similar genetics as well. And so in that sense, they have very similar reactions to drugs, and they are definitely used in like early drug trial stages as well. So it has very much contributed already in the past to medical advances. And you link that to kind of like talking about paracetamol and morphine and that kind of thing. And in that sense, by trialing it on animals, you're preventing sort of avoidable harm to humans. So it is in a sense kind of in keeping with beneficence as well, which is what you were talking about. And at the same time, it's also beneficial for like public health, because you're coming up with these drugs and trials, and that's used to kind of minimize people's symptoms and try to make them recover as well. So there are lots of pros to animal research. But at the same time, the main sort of con is to do with the animal welfare. So the fact that they are sentient beings, they have nervous systems. You might be putting them in pain or discomfort, or even killing them by doing certain different things to them. So is that really fair, just to sort of contribute to the beneficence of like society now and all of the sort of public health advancements that we have now? So it's about weighing that up. A couple of other things I talked about in the feedback, and the mark scheme, sorry, was that it's sort of hard to gain consent from an animal as well. So that's kind of going against autonomy. So if you sort of try and state the pillars and try and link the pillars a little bit more directly as well, that is something that Liverpool do like as well. So try and think about like autonomy and maybe justice, non-maleficence, beneficence, and just try and name them where you can as well, just to make sure that they're definitely giving you the marks for that kind of thing. But You did mention that it is complex, and there are a lot of things that we can do in terms of safeguarding. So, making sure that we are using ethically appropriate practices. So, something that you did mention was that we should consider alternative options like tissue cultures wherever possible. Um, some other points as well, you can maybe reduce the number of animals used or even refine the procedures so that you're minimizing suffering. Or giving them things like anesthetics so they don't really feel the pain as well. That's quite a good thing to do as well. And make sure that all your methods undergo like proper ethical approval, so nothing, because then they would have thought this sort of ethics out as well. So that you're making sure that the public health benefits outweigh the risks. So you definitely had a really good structure again. I liked how you kind of very like conversationally sort of talked me through the pros and then the cons and then pros and cons as well. So that really worked as well. So it doesn't have to be that you mention all the pros and all the cons. You can have a different sort of structure as well. So it's completely up to you, but definitely raising some of those safeguarding points. That is kind of encouraging you to think a little bit outside the box. So what can we do to fix the situation? So those kind of points are the points that you definitely should try and bring up in your interviews. So well done for that. That was a really good answer. Do you have any other feedback to give, Rima? Or
No, I think that was a really, really strong answer. I liked how at the start, um, you talked about what you already understand about the subject that was raised in the question. So your understanding of animal research currently before kind of then breaking off into pros and cons. And I think that structure really did you well. You did your answer well as well. And I would echo again all the feedback that was already mentioned.
yeah, so definitely very strong answer, and thank you so much for that. So who should we pick next? We've got one more
Uh,
question. It's this one.
I think it may have been Ash. Yes, I think it was Ash.
Okay, Ash, you can have a second to think about it and then give me your answer when you're ready.
Right. I think firstly, I think it's important to define what resilience is. So, resilience is persevering even when things get difficult. And I think a time where I've shown resilience is during my gap year. So, unfortunately, I didn't get into medicine the first year around. And after acknowledging that, okay, I didn't get into medicine and processing my emotions, I took it as an opportunity to reflect on myself and strengthen my application for medicine so that I would hopefully get accepted the following year. So firstly, I reflected on what things didn't go so well. So the main reason last year was my A levels. So unfortunately, I dropped a grade in one of my subjects, and that was the reason why I missed out on my firm university. And so I contacted my teachers and asked for some feedback on some of the reasons for why this may have happened. For example, um, were there particular topics I performed negative, like worse on compared to others? And then I used that as a means to reflect and decide what I could do to improve my score in the future. So after taking into account the feedback, I then created a plan. So I realized that actually I was focusing too much on the theory in terms of A levels rather than practicals and applying this knowledge. And so I took on an approach where I focused more on practice questions. And this has meant that hopefully my grade will improve this year and I can strengthen my application. And the reason why I've shown resilience throughout this year is because I acknowledge it's been tough having to have a gap year as I was expecting to be starting university in September. However, even though I had this setback, I reflected and I kept going as I was determined to pursue a career in medicine. And so that's how I've shown resilience. And I think that personally, resilience is a key quality that is needed in doctors or medical students. Firstly, through medical school. Medical school is a very demanding um, university course. So, for example, you have to learn how to balance your um, theory from university as well as being on placements. and then also your work-life balance. So I think having the resilience to push through medical school and then to become an actual doctor is really important.
Great. Thank you so much for that answer. Again, it was really nicely done. So you again had a really clear structure. I'm a big fan of structure, if you haven't already been able to tell. So I love that you defined what resilience was at the beginning so that I knew that you understood what resilience is. And then you moved on to telling me all about it. So I'm just gonna show you the mark scheme that I have for this. Okay. So I like to use the STAR framework. So we talk about situation, the task, action, result, and reflection. So you did exactly that. So you told me what resilience was, um, where you sort of persevere even when things get hard and difficult. And you mentioned your gap year as a situation and the fact that you didn't get in and the fact that you processed your information, but that led you to sort of reflect on where perhaps things went wrong and that enabled you to kind of strengthen your application. So that was a sort of task that you have to do now in the sense that you have to strengthen your application and figure out what went wrong in the sense. So I liked how you contacted your teachers and you asked for feedback. So that's really good. So taking it on board feedback is a really important thing to do, and you'll have to do that like throughout your life for various different things. So you have to just bounce back and really understand what went wrong. And you said that like maybe there are particular you focus a bit too much on theory rather than practical side of things. So that's what you're going to do. You're going to adapt, you're going to change. And all of these kind of words in terms of like adaptability, flexibility, reflection, feedback, all of these words are like key when you're describing resilience and how you're going to cope with this. So I like how you also just acknowledge that it has been tough. So it is a tough time, and you have to keep reflecting, you have to keep changing, you have to keep going because ultimately you do want to still pursue medicine. And at the end, you did talk about like why it's important in medicine. So you talked about like med school and how med school is really demanding in itself. So you have to just keep pushing. There will be people who are better than you, or people um, or just concepts that you don't really understand, and you still have to push through. Um, and also maintain a good work-life balance on top of that as well. So it can be quite tricky and demanding. So you do need to be resilient at times as well. And as a doctor, if you look at it from a doctor's perspective as well, there will be times when you make mistakes due to various reasons, or maybe a patient will die due to a various reason, and that might lead you to feel really sort of low about it and quite stressed about what you did wrong. But it's really important to be resilient, to pick yourself up and really reflect on what went wrong. And then you can also kind of have an MDT discussion as well, and just kind of get other people's opinions, get other people's feedback on what you did wrong and things like that so that you can improve. And that means the next patient that you treat, you'll end up treating them better. So it's really important to be resilient. And I just really liked your answer. I thought it was very well structured and you mentioned a lot of good things as well. So well done for that. Do you have anything else to add, Rima?
Not in particular, no, but the idea of linking back into medicine, I think, is one of the most important things about whenever you get a qualities question, because you want to essentially draw parallels between yourself and that of a good doctor. So give them more reason to believe that not only do you understand what makes a good doctor, but you are showing those skills now as well. Um, Essentially just giving them more evidence to believe that you would make a good medical student, and linking it into not only resilience when you're working as a doctor, but also resilience throughout medical school, to deal with exams, the workload, and perhaps strategies in order to cope with those things. But on a whole, I feel like you've covered everything pretty much in your answer.
Thank you.
Yeah, so definitely very strong performances from the three people that we've asked to give us answers to these questions for. These questions were not necessarily the easiest questions, I don't think, especially sort of the should research be conducted on animals question. Maybe it's something you haven't thought about at all. And that's what Liverpool will try and ask you in terms of ethics. They just want to see how you react to situations that are unknown. And that's why it's really important to just have a logical, structured approach with those sort of questions and just ask if you need a minute to think. It's completely fine. You do have 6 minutes in the station, so it's fine if you need a couple of seconds to get your thoughts together as well, because it'll make you seem more calm and collected on a whole as well. So, Yeah, that was pretty much all we had to say today. So thank you so much for coming along, listening to us today, and interacting so well with us today as well. And if you have any sort of questions, just put it in the chat and we'll get round to them as well. So I'm just going to stop sharing my screen. Oh, there's a lot of questions. Um,
Quite a few questions.
mhm.
Are the interviewers nice and friendly? What would be your take on that one?
Think it's very different for everyone because
Yeah.
obviously they're interviewing so many different students. You'll get a different set of interview to perhaps your friends. You'll get a different set of interviews to like anyone you've known. So it's quite hard to tell, and it's a little bit
Hmm.
subjective as well. I personally found like the majority of my Liverpool interviews were quite friendly. They were open to just having a chat and getting to know me. And I did have quite interesting conversations with some of them after like finish answering the questions as well. So they were quite chatty and friendly. But you know, you might have some that are not. But in that sense, you shouldn't let that throw you off. So if you know someone's stern from the beginning, that should be your kind of reason to try even harder. Like just make sure that you're convincing them that you're extra passionate and extra involved. And I don't think you should kind of get let down thinking about that sort of thing. But I think the majority of people, and like from friends and people who've also done the interview, I think the majority of them are quite nice, friendly, and they are just really trying to help you. They're trying to make you succeed. So they will ask you questions, they will push into things because they know what's on the mark scheme and they want you to try and access that kind of thing. So
Hmm.
don't worry if they ask you follow-ups. Just take that as guidance and really adapt to it as we were talking about before as well.
Hmm.
Mhm.
And I guess that also links into, do they cut you off if you're taking too long per question? So often, if they feel like they've got what they need from your answer, or if they'd rather move on so you can access more questions, that could be the intention behind the cutting people off. There's not always like a malicious intent. So don't feel like, oh no, they've taken my answers in the wrong way or anything like that. Be adaptable on the spot, and if they do cut you off, end your answer and just get ready to answer the next one based on where they want to take that conversation. So treat it as much as a conversation as you can, and it would feel less like an interrogation almost.
Definitely.
Yeah, amazing. So, guys, just want to say really well done on today's session. I think it was super, super informative. And I'm looking at the chat, there's a lot of questions about sort of running out of time and being cut off. So, if everyone is sort of happy with that, we can move on to maybe questions that are, there's a lot of questions also about thinking about the why medicine question. So, is there anything that you'd recommend that isn't too common, but is an aspect that you might not be considering in terms of that are the cliche answers in terms of sort of work experience or personal experiences? But is there anything that you think you could mention in that question to help someone stand out?
Perhaps if you're interested not only by like the human aspect, but also the potential for medicine in the future, because I think a lot of the time in why medicine, people think about the past, what's happened to them, and like the current state of the NHS, the roles that are currently there for doctors. But there is a lot more out there for doctors and potentially into the future as well. If you're really interested in things like how technology can have an impact on medicine, perhaps the university that you're applying to has a focus on that as well. I think I remember reading that Liverpool has like simulation-based learning and integration of technology and artificial intelligence into the way they teach. So medicine is no longer just medicine, if you get what I mean. So if you're interested in where medicine could take you and the opportunity to go into different kind of paths as well, um, that could be something to mention. And also that could directly link to the university and the facilities that it offers, perhaps some research trials that they're undergoing as well that aligns with your interests. Because perhaps most people wouldn't have considered that. Um, yeah.
Yeah, that's what I would say as well. Like just having a little bit of a research into like what are the uni doing in terms of clinical trials or any affiliated hospitals? What are they working on? What are they seeing? Is there anything that interests you particularly? And have you had any experience with like research and things like that before? And that links into sort of how the direction that medicine's going to take in the future as well in terms of like technology and different things like that. So lots of different things to say. But I think those kind of concepts that Remo was mentioning, that does help you kind of just be different from other people in a sense as well. So yeah.
Yeah, definitely. So I'd also say if you think there's an aspect of medicine that really resonates with you, so that could be the teamwork aspect or the empathy aspect, then feel free to sort of be a bit more specific on that particular topic. So thinking about potentially the MDT and sort of working together for one common goal, which is improving patient outcomes and caring for people. If that aspect is something that really resonates with you and you have examples that you can use to support it, then you could definitely take a more specific angle in that question as well. Another person has asked, what question suggestions do you have if you finish early? In terms of what would you ask the interviewer if you have some spare time?
I guess it's just about kind of making friendly conversation. So um, I think you should maybe if you, I think at the end of a station, right, if there's anything that you want to say that you maybe didn't get a chance to say, then definitely prioritize that. So just say, is it okay if I go back to this question to finish answering because I just had another example from my work experience or whatever it is? Then ask those kind of questions. Make sure you get everything that you want to say out of you. And then after that, then you can just make friendly conversation with them. So just asking them how they're doing, or there are lots of students that they've interviewed today already, or like if they're so like my interviewer was wearing scrubs that had a specialty on it. So then I started asking him about his specialty and his job and what's that's like. And just to be kind of more inquisitive about it. And that just led to some great conversation. So I would just be kind of flexible, adaptable. Don't be too rigid, being like, okay, I'm gonna ask them these questions if I'm done. Just see how it goes. Like you're all friendly people, you're all chatty. I'm sure you'll be fine making conversation at the end.
Okay, and then another person has asked, what are the drawbacks of the University of Liverpool? So I'm not sure if this is as part of an interview sort of aspect, or is it more just for, life at the university? But if you guys could give a couple of ideas on maybe some things that you're not too keen on.
I think because when I first started learning all the content via like more online means, I think I wasn't really expecting it to be that online, if that makes sense. Like there's just so much online content. So I'd say that's probably one of the drawbacks in a sense that you have to be very driven and self-motivated in order to like finish all the lectures because it can get kind of dry in a sense. And it's not necessarily in your timetable, so that means that people might just not do them. So I think that was probably one of the drawbacks. But I actually, reflecting on that now, I actually really prefer having online teaching because I think it just means that I can take my time with learning the concepts that are highlighted in the lecture. So I could just pause whenever I want, make my notes however I like, draw diagrams, do whatever. And I think ultimately that helps with my retention as well. So I don't really have to revise the concept as much because it's kind of ingrained in my head. But it is kind of annoying having to just do everything online because that means you're having a lot of screen time. You're having probably less interactive time with the lecturers themselves. Um, but that's kind of the main drawback I would think about. But I think I've overcome that over the last couple of months as well. So I don't find it too bothersome anymore.
I just wanted to add to that. Wait, I think I'm echoing. I might mute my phone first. Yeah, just wanted to add to that. I think how good that answer is an example of what you need to do in your interviews. So, like, we had the question, what do you not like about Liverpool? What is a drawback? And did everyone in the chat see how Anushka managed to deal with it so kind of appropriately and sensibly in terms of how she started off with a negative and the way she actually managed to turn that around to a positive by the end? So if you get any of these questions of that sort of nature, give an example of a time where you made a mistake, give an example of a time where you failed, something that went wrong, you want to be structuring it exactly like that. Start off with something like, this is what I don't like, and this is why. But actually, here are some of the advantages. And actually, it turned out that in some ways this was good for me, and I started to like it towards the end. If the question is, what is your greatest weakness? Maybe start off with why it's your weakness, but also how you're working on it, how you're developing it. And while it remains a weakness, you've put in place strategies that mean it doesn't affect you as much. So that kind of diplomatic approach to answering tricky questions is an important interview skill that clearly Anushka has done very well to develop, and hopefully you guys all will as well.
Scanning the chat to see if there's any more questions I can answer. Hmm. There's a question about sort of when you link back to working as a doctor, so why things are important in medicine. Do we refer to ourselves as a doctor, or do we speak about doctors in general? I guess that's kind of a niche thing. I would say just speak about doctors in general, because at this moment in time, like none of us are like proper doctors yet. So just talk about like when we're about to be doctors in the future, or like that kind of thing, or just medicine generally in the future. Um, then that's pretty much all right. I don't think they'll really mind as long as you kind of recognize why something is important to medicine in the future and just make that link at the end. I don't really think they'll mind like how you phrase it necessarily, but um, yeah, that was that question. Um, Someone asked if you should shake the interviewer's hand. That's a bit of an interesting one because not every interviewer will want to shake your hand. If they make a sort of gesture which seems as though they want to shake your hand, then shake it. Don't just leave them there. But just kind of assess the interviewer's body language. Often they'll probably be sitting down, they'll have their laptop in front of them. They probably won't shake your hand. But if they do, then definitely make sure to shake it back. I think you just have to sort of read the room for that one. Unfortunately, I can't really give much advice beyond that, but yeah. Ooh, someone asked an interesting question about if there's anything that we regret in terms of our preparation for our MMIs when we did them. That's an interesting question, actually. It encourages us to reflect on stuff that we did. I think I think personally, something I might have done was sort of over prepare. And I think I realized that when I was going into my first interview. Sometimes you've got to strike that balance between preparing adequately and over preparing, because you don't want your answers to start sounding robotic. You want to sound natural as you can. So, and you also don't really want to be bored by the time you go into the interview. So sometimes after I'd answered my why medicine questions so many times, I'd start to lose the passion. And I think you just want to really retain that natural passion, that natural excitement. So you don't want to over practice, but at the same time, you don't want to under practice because you don't want to go in and be blank. But if you are blank, it's fine because there's often times in Liverpool where they'll ask you just random questions and you will be blank. But it's better to be as natural as you can than trying to think that you can prepare for absolutely everything and then sounding a little bit over prepared, potentially monotonous, that kind of thing. So I think I realized that. Luckily, I realized that quite early on that I was sounding like that. And so then I decided to just kind of take a break from interview prep, do something else, and come back to it later on. And then my answers started flowing naturally again. So I didn't find that was that much of a problem when I got to my Liverpool interview. So luckily I made it here. Um, Rima, do you have anything else to add for that one?
I think I fell into the same trap as you, in the sense that I felt the need to make model answer almost for every question I could think of. And then it would work myself up if I couldn't remember everything. But then I felt like if I just had an idea of what I would want to say, the answer seemed a lot more natural and therefore perhaps stronger as well. I think I also spent a lot of time focusing on things that perhaps didn't need that much time. For example, there's loads of cases out there like the Baba case, Charlie Gard case. I use that really. I think at one point I did make a Quizlet set on them, like religiously learning the facts, like oh this happened in this year, um, and then I quickly realized, I think after my first interview, that it's only like relevant to include where you think it fits, but it's highly rare that they would ask you, tell me as much as you can remember about Charlie God. So I think I definitely should have prioritized my time elsewhere, or perhaps not worked myself over things that didn't need that much attention.
Yeah,
I think that's
definitely.
a big thing that we see from people over and over, especially when kind of you search up on Google MMI interview content or MMI interview preparation and you see big long lists of cases. Specific details about them are just not required. The only time it's going to come up is say you want to relate it to a particular scenario. And if you're trying to do that, have a think. So if, for example, you're talking about the Bawagaba case, and maybe you want to do that if the question is about recruitment and retention crisis, and you're referring to understaffing, or you're talking about, say, ethnic minorities in the NHS, and you're linking that to the Bawagaba case as an example of where maybe ethnic minority doctors are not treated to the same standard. If you're speaking about those things, it's really not relevant what year the event happened in. What are the very specific details of the case? It's having that broad understanding and being able to make links. So, particular cases, knowing where they link to different interview hot topics, knowing maybe how you can relate them to stuff that's happening in the news right now. So, I would really try and avoid kind of going on websites and making a list of every single case you see or trying to learn tons of statistics. I would pick like a couple of examples of things that really interest you that you can relate to a lot of different topics. So, for example, healthcare inequalities, talking about how quality of healthcare may vary between different socioeconomic groups, why that might be the case, what sort of impacts that can have. Learn about that. You can link that to so many different questions now, no matter what the station is. And it's not that you need to know specific facts about it, because they're not going to ask you one question and is it a yes or no answer? It's just going to be whatever you do remember will be great to bring up. So I think at no point really do you need to be making extensive notes on facts or Quizlets and revising them. Instead, I would just find out, okay, what are your core interests? So if your core interests at the moment are, say, artificial intelligence in the NHS or, say, socioeconomic inequality, if that's something that you want to talk about in all of your interviews, every morning just go and do a little bit of reading about it. And rather than memorizing points on certain websites, form your own opinions. So read a couple of articles every so often, know what's going on, know kind of the bigger picture of that space. So, like me personally, I run all of these sessions. I don't sit and memorize specific details and think this is the. I'm just aware in general of think is relevant to some of the questions. And that is the way I would recommend approaching this. Like, say, a doctor might kind of reading the journals, reading the news, seeing what might be relevant to their practice. I wouldn't recommend trying to make a list or worrying if you forget specific stuff. Does that make sense for everyone in the chat? And on the whole, hot topics, not necessarily the biggest thing for most medical schools. Obviously, it does depend, but personal qualities and SJT by far more high yield than any one specific hot topic. Because the chances of that specific one hot topic coming up very low, the chance of some sort of personal quality coming up very high. Some kind of SJT question coming up that you can link to GMC good medical practice, very, very high. So it's just about thinking where should you focus your time for actually preparing interview answers and not preparing interview answers by writing out, say, full paragraphs, just a few bullet point thoughts. That's sufficient. That needs to be done for sort of your core questions. And for your hot topics, just a little bit of reading about big current affairs. Now, Anjali asking, are there any hot topics that are less obvious you might suggest looking at? I think the less obvious ones, just go for what you're interested in. So, like me personally, I run all of these sessions. And that is the way I would recommend approaching this. Like me personally, I run all of these sessions. And that is the way I would recommend approaching this. I think the less obvious ones, just go for what you're interested in. So if you're trying to look at, say, something that's a little bit more niche that you're going to bring up to your answer for why medicine or for why this uni, and you're going to say, well, I'm interested in this area of research, in that case, it's just about finding what interests you. And so go in the news, look at if something interests you, and then pursue that further, read more about it. In terms of hot topics that are really big for this year that may come up and that kind of are important to go over, I think technology in the NHS definitely a big one. So, what are the issues with technology? What are the barriers? Stuff like I think 3 hospitals in the UK still using fax machines. So, all about kind of that digitalization. What is the influence of stuff like telemedicine? So, kind of as of this year, the government has made sure, or as of 2025, the government has made sure all GP surgeries, trying to make sure they all provide digital consultations. What is going to be the impact of that on patients? What are the pros and cons of telemedicine? Artificial intelligence kind of continues to be a huge one. So, very, very specifically, what can that do for patients? Go over some examples. Sustainability in the NHS has been a very big one in recent years. So things like climate change, what is the impact of the NHS on stuff like that, both ways. So how can healthcare be more sustainable? But also maybe how does climate change, how does the environment affect human health? So that might be, for example, changing weather patterns and how they can increase risk of stuff like, say, cardiovascular disease, heart attacks, strokes, might be stuff like if climate changes and we've got increased numbers of pandemics, zoonotic diseases where things jump from animals to humans, like COVID-19, very much influenced by climate change. So we've got sustainability, we've got technology. I would say socioeconomic inequality more so nowadays. And those are sort of some bigger hot topics that maybe were overlooked in the past. Then this year, I would say because there are ongoing kind of another round of doctor strikes, we would be very much aware of why they're happening and why specifically this year what's happening is different. So, what do we know is different about the doctor strikes this year compared to in the past? Put in the chat. So, we've been striking for years now. Yes, specialty training places. So, a big thing from the BMA this time is all about the competition ratios and bottlenecks. It's not just about money, the fact that doctors, after they complete their foundation years, not able to get into specialty training. And sorry to interrupt you guys, Liverpool Q&A. I'll let you guys finish off with that, and then I'll go into a more open Q&A when you guys are done. So I'll let you guys continue.
There was one question about what was your routine for the day before and like just before the interview. So I mean, personally, my routine was trying to get to the location that kind of happened the day before. I just briefly go over my notes the day before, just because I'm someone who does kind of like preparing right until the end. But I made sure not to do any prep on the day of the interview, just to keep a really fresh, clean mind and just sort of relying on the knowledge that you already have. And because I'm a person who gets quite nervous as well, it was mainly on the day, it was mainly about sort of managing my nerves and like trying not to get too stressed out about things. So just before the interview, like I had a morning interview, so just like make sure you're well fed, you've drank enough water, that kind of thing. You've slept enough before the interview. Don't stay up too late, like reading, and none of that information is going to actually go into your head that close to the interview. So just rely on all the prep that you've done. So max, I would say study the day before, but don't actually study on the day of. So that's my advice.
Yep, I would agree with that. I think my Liverpool interview was in the afternoon, but the morning was kind of consisted of traveling to Liverpool, so I didn't really get a chance to stress myself as I usually do. Um, but yeah, I would agree. In terms of prep, I would do my final bits of prep the day before. Um, and I think if you really did want to just flick over things before you go, it can be just mentally remembering the kind of things you've done, your work experience, were there any specific situations that stood out to you, just so that they're at the top of your head almost. But I wouldn't like try doing mocks or anything like that because it's most likely just going to stress you out. And I don't think that would work well in your favor either.
I see a good one in the chat. Liverpool, is it scarier than other interviews? So maybe why is it scarier and maybe why isn't it scarier would be a good way to divide it up if you share your thoughts.
Okay. That's an interesting question. I think the first thing that I found was kind of scary about the interview was probably the location of the interview, the fact that it was in the crypt of the cathedral and I
Yeah.
had no idea how to get there and also no idea what I was expecting. And
Hmm.
then I walk in and it's just dark and dingy and like spiral staircase and I was like, oh,
Yes.
I was terrified. So I think it was mainly the location which scared me. But once we ended up in a well-lit room, once the sort of dean was like explaining how the interviews would go, I felt a lot more at ease. But it was just that initial entering the crypt of the cathedral, which made me really scared. But I think during the interview, I wouldn't say anything was necessarily too scary. I think it was just a general MMI, and it was pretty much over in a flash. So don't worry about that. I think the scariest station, in my opinion, was probably my ethics station, just because they were really like prodding into my answers. So they were saying like, okay, you mentioned this, now tell me more about this. Like,
Mm.
what specifically did you mean? And I was really like pushed. I think they really wanted to squeeze every inch of knowledge that I had, based on the things that I was saying. So the ethics ones, they are more conversational, so that means you do have to just be really adaptable. And if they suggest something, you've got to just think of an idea in a flash. So those questions are quite hard, I would say. So that's probably the scariest part of it. The personal quality side of things, I think, was pretty straightforward because you know what you've done, you've lived your experience. No one can tell your story better than you can. So I think they're fine. But I don't know, Rima, do you have any other kind of?
I think for me, in comparison to my other interviews, I didn't get much prodding, whereas Liverpool was like my first experience of someone just attacking. Well, it wasn't attacking. I felt like some questions, I think in particular the discussion station, they often were presenting their own ideas as well, which did throw me off initially because I was used to them asking me a question and I can just speak. But often at times I would have to cut my answer short and respond to their suggestions and then go back to my answer. So I think that was a lot of like thinking required for one station. Um, but yeah, also the location of the place is quite scary as well, and actually finding it because it's not necessarily within the medical school. It's like at the basement of a cathedral and it's cold. So the atmosphere outside is pretty much depicting what's going on inside as well. Um, but I think the best thing to do is even if they do start prodding you, like see it in a positive way. They're trying to get you to where they want you to be. They're trying to give you the place, okay? So it's almost like they want to give you the place until you give them a reason not to. Okay, if you think about it like that, you wouldn't feel too stressed about, oh, why are they prodding me? Oh no, maybe I've said something wrong, and you start spiraling a bit like the staircases. So try not to do that. If they do prod you, it's for the right reasons, and follow through with it. Understand why they're prodding you, and don't be defensive or anything like that. Just go with the flow, I would say.
What do you think about the duration and kind of stamina you might need for it? Was it a little longer than some of your others, or how did it compare?
I would say if anyone's done a Leicester interview, it's not as long as that. I think that was probably the
Mm.
longest it gets. It's so long. So I think it was generally, I think 6 minutes per station, 1 minute in between. It's a fair amount of time. It's pretty much
Hmm.
done by like roughly an hour is out of there, so it's not too long, I don't think. It doesn't last for longer than an
Hmm.
hour, so it's generally okay. And you do get like a minute of breathing time before each station as well, where you just stand outside. And I'd really recommend like if they tell you what the station's going to be about outside, so just start assimilating your thoughts. Just forget what's happened in the previous station and just move on. Think, okay, if it's on the roles of a doctor, let me just think about what I know about the roles of a doctor and then go in. And if you just spend a minute thinking about the next station instead of thinking about what's happened, that
Hmm.
is going to be good. And that's going to help you just get through it in a flash. And then you can sit and reflect on it as much as you want after it's done. But just while you're actually doing the interview, don't spend too much time thinking about the previous station. Just move on and it'll be over in a flash. Just a tip about like the location as well. Obviously I mentioned it's in the cathedral. Someone told me that you should go around the back of the cathedral, and that actually saved my life on the day. So make sure you go around the back and not up the kind of central staircase. You'll see it anyway. It's just like a huge metropolitan cathedral in the middle. don't go up the main stairs at the front, go around the back and make sure you go downstairs because it's in the crypt, so it's down, not up and then down. So that's kind of my biggest tip. And someone told me that before the interview, it really helps. So I knew where I was going. There's also a question about what is CBL and PBL and how do people learn from case studies? So I can talk about CBL because that's what we do at Liverpool. Essentially, we get a booklet for each system block, and we get three cases based on the content that we're covering in the lectures. Those cases, you basically read it. It's not too deep, like there's not too much medical jargon involved in the case, so it's very accessible to your level of learning. And then you get asked anywhere between like 3 and 10 questions about the case. And it's usually just like describe the anatomy of blah 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 or like why do you think the blood pressure went down and things like that. So you can use a combination of you can use a combination of your lecture notes and a little bit of like research into potentially like medical papers and things like that to figure out the answers. It's not too hard to find the answer to the questions. And then in your like large CBL session with your tutor, that's the session where you're not allowed to use your notes and you just kind of talk about everything that you've done in the case without just relying on your own memory. So that helps you kind of remember all the stuff. And I think at Liverpool itself, like the cases that we do, it really helps me like consolidate the knowledge that I've learned in the lectures. So I come out of CBL being way more knowledgeable than when I went in. So and in a good way, like stuff that does come up on the test is assessed in the CBL as well. So I think it's really useful. I'm not entirely sure about PBL because I obviously don't do it, but um, if anyone knows anything about PBL, go for it. I think it is kind of similar in that sense, but
I see a lot of stuff happening in the chat for how would you go about preparing for ethics preparation and discussion stations. Is this something that you specifically spoke about today, or is this more a general question?
I did
It
mention
seems
it. Yeah, I did mention that one of the stations it tends to be a preparation station, and then one of them tends to be a discussion. So you'll probably get like a text or some sort of data or a text or something to analyze, and you get 6 minutes to just analyze the data and assimilate some thoughts on it. When I did the interview, you could write down thoughts as
Mhm.
well and take it into the next station. I'm not sure how it will be this year. It's always different every year. So, um, but I don't think it's too worrying. I think all you need to do is kind of stay true to the pillars, medical ethics, to see how it relates, because that gives you your first line of what to say. I think so if you're struggling, just think about the pillars. Um, and then also, as I was saying as well, think about kind of extra things. So things you would have wanted done differently in the case, things they didn't mention in the case that you want to know more about, and think about really using that biopsychosocial approach as well. So think about like if there's something out of the box that you can say, try and say it in those discussion stations. But mostly they will ask you questions. So they'll ask you what they want to hear. And they might ask you about your opinion on something slightly random in the station as well. So you just got to kind of have a chat. It's literally a chat and it's pretty chill. It's quite interesting actually. So the situations that they'll ask you about are things you've probably never heard about. So don't stress too much if you can. Just try and keep a really logical, systematic approach, is what I say.
Mhm. And I think it also helps that the preparation for the discussion, there's nobody in the cubicle, so it's just you, paper, table, and a pen. So it can actually be a good way to de-stress from the previous stations. And you can take that piece of paper. For my year, so 2 years ago, you were able to take the piece of paper as well. So kind of organize it there in a way that you would be able to pick up the most important things. I wouldn't try and, write a model answer or anything. You don't have the time for that. So the most important thing is structurally, what are my points I can get the most substance out of? What are my like interesting points that are outside of the box as well that you can add in that discussion? And do treat it like a discussion as comparison to the other stations. It's not like they ask you the question and you respond and it's end of station. It will be back and forth, so it shouldn't hit you by surprise necessarily.
Someone asked if
If
there's
we
a maths calculation question. There wasn't for our interviews,
No.
so it's unlikely. I just tell everyone to revise it anyway because say there's some sort of breach and some of the questions are leaked, it's quite easy for them to just put in a maths question last minute and make a station out of it. So just make sure you know how to do the calculations, but I don't think it's something that will come up necessarily.
No, I didn't get a calculation station either for Liverpool. Uh,
Any questions here that are not general and still Liverpool specific? Otherwise, we can
I,
move on.
yeah, I think we
Um,
answered majority of them.
we got all like I can see a Liverpool Dent one, but I mean one specifically for Anushka and Rima.
Um,
Let's see. Any other Liverpool medicine people?
is there
Is
data
medical
in
school at
directory?
Liverpool stressful?
I think you'd be best at.
I I wouldn't say it's too stressful. I think there's a bigger emphasis on enjoying medical school at Liverpool. So everyone's really nice, everyone's really friendly. The lecturers are really approachable as well. So if you go to them at the end and ask them questions, they're more than happy to answer them. They also have since everything's online, I think it kind of reduces the stress of it. So the uni essentially took like a survey from students about their preferred methods of learning, and that's why they've moved to this online kind of hybrid approach rather than just having everything in person. So that means that if you're tired or like if you're having a bad day, it doesn't really impact how much you learn because you're pretty much learning everything beforehand. So I don't think it's that stressful because I know that I have the lectures that I have to do and then I just do them in my free time. It can get stressful if you fall behind though. So definitely people I know who are really behind, they're finding it quite hard to catch up. So you've just got to make sure you stay on top of things so that you don't get stressed in that respect. But everything else is just like it's really chill actually. The labs are very chill. Clinical skills people are really nice. So if you're doing something wrong, they'll just explain. No one's going to shout at you or yell at you, because they understand your first year. So I don't actually think anything's stressful in particular. And even the fact that they keep regularly assessing you as well, it means you get used to the style of questions that they're going to ask. You get used to using the online platform. And the tests are all the block tests are all open book as well if you want to do them open book. I don't really do them open book because I just want to know how much I know. And the uni don't look at the scores either. So they're really trying to minimize the stress. And give you enough experience so when you do the exam, you know exactly how things work and what you're expecting. So I don't think it's too stressful, personally.
I think a big thing for you guys compared to what you might have experienced so far, every step of the process so far has been very, very competitive. So, like your GCSEs, you have to be going for eights and nines. Your UCAT, you try to go for a top score. Your interviews, you try and outperform the competition. Once you get to medical school, all you really need to do to become a doctor is to pass all of your exams. So, while the content may not necessarily be easy because there's a lot of it, the competition aspect definitely, if you choose to see it that way, goes down by quite a lot. So the way that kind of the jobs are allocated in the NHS now, how you perform at medical school has no bearing on what career you pursue at the end. Whether you graduate at top of the year at somewhere like Oxford, or you graduate bottom of the year at maybe one of the newer medical schools, it makes really no difference as long as you've graduated with the medical degree. And so I would say definitely see it as like keep on top of things, so don't fall behind, as Anushka said. But I think definitely see it that you can do other things as well. And in some ways, it's an opportunity to maybe relearn habits because kind of so far it might have been like, I need to get myself ahead. I need to make sure I'm at the top. You get somewhere like medical school, everyone is very, very smart. Everyone is used to being at the top of their class at school. Be prepared for that not to be you, but at the same time, maybe be a little bit less worried that actually, in some ways, the hard part is done because kind of most people who start first year of medical school, vast majority end up as doctors at the end. So kind of that in that sense, the hard part is done. Obviously, you do need to work very hard, but maybe some of the pressure will be off you, the sort of stuff that you're facing right now with your interviews and that unpredictability. Brian, don't people say if it's too hard, people drop out? There are dropouts from medical school, and there are people who may fail resets and then leave. but proportionally, that's kind of, it's not a huge number. It can vary by medical school. So Liverpool, Anushka, any thoughts? What is the failure rate past year one? I wouldn't imagine it's more than 10%. How many drop out or fail?
I would say only around 10%. And I think it's the way they do their like final exam is quite different to like other unis as well. So it's trying, so you basically have this thing called like sequence one and sequence two. So if you do sequence one and you get like a fantastic score and things like that, then you don't have to do sequence two. But if you're kind of within 10% of the pass mark either way, either 10% above or 10% below, then you have to sit sequence two, and that's just basically another exam, but it's the exact kind of same style of exam. So it gives you another chance. So if you absolutely flop sequence one, and if you do brilliantly in sequence two, they basically just take an average of your score, and that will end up bringing it up. So they are trying to get as many people to pass so people don't drop out for those sort of reasons. For other reasons, people might just not like medicine and drop out for those kind of things. So I can't imagine it being more than 10%, but I'm not particularly sure on like the specific stats for that. But I think they are really trying to make sure you pass at the end of the year, essentially.
Lot lower stakes than getting into medical school at least. Like they want you to become doctors because there's no point investing time and money into teaching you for a whole year and then having students drop out, and that's a complete waste of like no return on investment. So once you're into medical school, they do try their best to keep you there. And at pretty much every medical school, even if you fail exams, there'll be kind of opportunities to submit extenuating circumstances, opportunities to resit. Basically, once you get there, hopefully the pressure is off. So just push through any remaining interviews, push through your A levels, and hopefully things get a little bit better from there. Role plays? What did you guys think for Liverpool role plays? Did they
I
come
don't,
up? Were they high
I,
yield?
I
I
didn't
didn't
get
have any,
no.
so I don't think they're, I think they've changed it as well. Like maths, it might not come up this time round. So I don't think you need to worry about it. They're very ethics heavy, I think, at Liverpool.
Hmm.
Ethics and personal qualities. So those are the two things you really need to focus on. They don't really care about role play or maths or anything else. They just really want you to evaluate things. And they want you to be like systematic, logical, as I keep saying. So yeah, definitely focus on those more than role play or anything else.
And I think most of my interviewers were actual clinicians, surgeons, they had their name tags on. So I don't think they would do role play with us. And they'd rather just see how you think about an ethical situation because they've got the clinical perspective as well. And they'd rather just discuss with you, oh, why do you think that way? Or suggest alternatives to your perspective too.
Yeah, I agree. Lots of different clinicians and professors, so they didn't really want to do role play as much. So yeah, that's pretty much all I'd say for that. Let me have a look. Someone asked, are private accommodations similar in distance to the main medical campus? Yes, they're quite close by, actually, closer than the Green Bank accommodation. So that's always a bonus being close by. They're not too far, and you won't feel isolated being in a private accommodation at all. Um,
We wrap up there for
Yep.
Liverpool Med session.
Yep.
Yeah, thank you so much, Rima and Anushka, for that. Very useful, and I'm sure you guys have enjoyed it. So yeah, put a big thank you in the chat, and we might do like 15 minutes general questions as well. But I'll probably let you guys make a move because it's 9 p.m. and I'm sure you have things to do. So I hope everyone has found that useful. And hopefully, Anushka will see many of you at Liverpool Medical School soon. It was only a year ago so Anushka was in our program and I was at her school, invited by her and another guy who's now in KCL first year who ran the MedSoc. And yeah, I was giving a talk there and now they're giving talks for us.